Grid 110 is a startup accelerator and nonprofit organization here in Los Angeles, where we work with early stage entrepreneurs and help them to get to the next level. So all of our panelists are Grid 110 alumni founders, so they have previously gone through our accelerator program. So excited to hear what they've been up to since graduating, all of the exciting things. For those who signed up to attend, I got a bunch of pre-submitted questions about today's topic, so there's a lot of good stuff that we'll talk about. But to get started, let's get a better idea of who our panelists are, their background, what they're working on with their companies. So we'll start off with introductions and then we'll dive into some of the pre-submitted questions. But Audrey, why don't we start with you and Ruth Health? Tell me, what is Ruth Health? How did you start this company, and what are you working on?
So Ruth Health is an integrated AI platform where women can book pregnancy ultrasounds, at-home ultrasounds, and pregnancy coaching via telehealth within 2 minutes. And what we're doing is supplementing the OB experience. We're not replacing, we're working with and within the system. So that is what Ruth Health is. How we came up with the idea was we actually entered Grid 110 as a different company. We were actually a medical device company, and I'm sure y'all ladies know what a speculum is. You know that car jack they put in you? Yeah. Nobody likes it, right? So we actually came into Grid 110 as a hardware company, building a more comfortable speculum, but then we realized hardware is hard, right? It's very hard to get into a hospital. And then we took a step back and realized it was actually an ecosystem level problem, that care was really fragmented, and especially within pregnancy because it's such a high volume time. So for example, when you go to the OB, when you're pregnant, you get 15 minutes, maybe. If you're a Kaiser, it's 10 minutes. That is not enough time to ask anything really. Like, you're in and out. You have probably a list of a lot of questions when you're pregnant because it's a very, it's exciting time. But then you're going on Dr. Google and you're freaking yourself out, right? So the whole point of Ruth Health is to eliminate that, provide evidence-based answers using telehealth coaching. So we'll have a certified nurse practitioner, or someone like Kristy, who's also very experienced in the space, and I'll let her introduce herself. But we're there to do the telehealth pregnancy coaching so that you can ask us these questions like, can I have sushi? Can I drink wine, right? So the evolution really just came from a device, because everything has just really not changed in our world. The device is 150 years old and no one's really done anything to change the speculum. And the history behind it is just really insane, and we can get into that later. But we all know that women's healthcare has been really, really overlooked for many years. And that's why I think, the three of us speakers are in this business. And I feel like I'm on Clubhouse where I have to say, I'm done speaking.
I have a quick question for you. So since graduating from the Grid 110 program, what are some exciting things your team has been working on? Some wins?
Gosh. So many wins, a lot of things we can't really share yet, but we are, closing around of financing, which we'll be able to announce. Very excited about the people we have on board. And I think that, now we just have to build. So there's so many exciting things that happen. A lot of them are actually, I can't say yet. So, but the pivot happened during Grid 110, and it was because Mickey kind of planted the idea in my head of, the device, how do we get it to people? Well, if we create our own practice, we can just supply ourselves. So it started off with that kind of, Vicky, it started off with that kind of thinking. We were actually at a pool, I remember, and I was like, wait a second, this makes a lot of sense. Like, why are we at the mercy of like these old white men that do the purchasing, right? Why don't we just do it ourselves and bypass them?
And you mentioned something about Dr. Google and Googling all sorts of things and Googling your symptoms, which makes me think of how Crystal's company got started way back when. So Crystal, if you want to introduce yourself, what your company does, and sort of your evolution of going to Grid 110 and where you are now.
Awesome. Thank you very much. It's always nice to hear folks like Audrey who are doing the same thing in this space, and I resonate with everything you say. So just FYI. I'm Crystal Adesanya. I am CEO and co-founder of Kiira Health. We're a telemedicine company for young women, and we connect them to trusted clinicians via our mobile app, so they can talk to, your primary care providers, OBGYNs, and mental health experts, available 24/7 via phone, video, and chat. And right now, what we're doing essentially is working with young people in colleges and universities to kind of work with their health centers as a partner in providing the care that the students need, and making sure we're introducing care to them really early, and creating that ripple effect that is important for the rest of their lives. A lot of what we see is, folks focusing on one segment of a woman's life, as far as like when she's pregnant, when she's having a baby, but forgetting she has, tons of years before that and many, many more after, where she needs to be healthy. So that's the space that we're playing in, making sure, that care is available to them at the time that they need it the most, when they're young, independent adults experiencing things for the first time and things like that. So I started the company, as Elizabeth said, based on a personal health experience that I had while I was in college. We've evolved over the years, and I'll go into that in a second. But when I, conceptualized the idea, it was based on, Googling my symptoms. So I am an immigrant. I'm originally from Nigeria. I moved to the US as an international student. And while I was navigating like school and everything else, I kind of didn't quite have, that comfort level or intro into like speaking up about your health or speaking about women's health issues or anything like that because of my background. And, I spent a lot of time on Google, right? So Googling all my symptoms, not wanting to talk to anyone about what was going on with me because of that, discomfort one. And I also did not really find providers who really looked like me, who understood what I was going through. And I think that's a big problem, within the healthcare system, not really being able to be surrounded with providers who understand, the social, cultural, and, racial nuances of healthcare and providing those services in an accessible way, right? So I Googled my symptoms. I, ended up self-medicating for period cramps because, well, it just made sense for that to be what was going on with me. And a few days after, I actually passed out and was rushed to the hospital for emergency surgery in a very different condition from what I was Googling. Now, fast forward from that experience, of course, asking a lot of young people who are similar to me questions around why you're not seeking care and, what's going on. And did you have an experience like this? And what I did find was a lot of people even had worse experiences than I did that could follow them through the rest of their lives. So that's when you think about this is the most pivotal point of a young person's life, which could really make or break their healthcare experience, right? And what we started to think about was how do we create a platform for folks to talk to providers, at least as a baseline, to get the right answers they need instead of, Googling. So creating that paradigm shift from Dr. Google to a platform like ours where you could talk to real providers and seek medical advice. So I think that was one of the bigger things. So we started out, as a healthcare platform that was providing only health education. So no medicine at all. So that's kind of where we started. And when we went through the Grid 110 program, that was basically what our app was. It was a platform where you could go ask a question and talk to an expert. Now, in 2020, we made this, kind of jump into something that was ahead in our roadmap as far as providing telemedicine. And we went head into doing it. And we started to get licensed in different states and started onboarding clinicians, started providing medical advice now and providing prescriptions and things like that through our app. So it's really exciting, just evolving and going with the times. And a lot of what we did was based on feedback that we actually got from our existing users, folks asking, the question of like, hey, do I get to talk to a doctor on this app or am I just chatting, right? So it became that, that need was, highlighted during COVID, as you all know. And the space where we, like I said, decided to work in was in these colleges because a lot of them are struggling to figure out how to manage their students' health, with students traveling all over the country and not having access to care, even though they're paying for a lot of these things. So now that we're licensed, I believe right now, and this is like a newer thing, we're now licensed in 16 different states in the US, and we're trying to get to 50. So that's pretty exciting for us, so we can reach, many, many students all over the country. So yeah.
Crystal, I need to talk to you about that because we're in the process of that too.
Oh my gosh, it's a lot to learn. I'm happy to talk to you about that.
Amazing.
Well, thank you for sharing all of that. And our third panelist for today is Kristy. Kristy, if you want to share a little bit about what your company is, what you do, and anything you've been up to since Grid 110.
Sure. So yeah, my name is Kristy. I'm trained as a women's health PA. So I've worked in OBGYN for about 7 years. And I started a company called Preconception, which is the first and only preconception testing company that offers nationwide direct-to-consumer testing. Many women may not be aware, actually, that when you are planning a pregnancy, the 12 months prior to when you would like to begin trying is called the preconception period. And there are a series of steps that you should be taking during that time to improve your health, one of which is laboratory testing. And so we offered in 47 states, because there's a few legal barriers and a couple others, but in 47 states, so almost nationwide, we offer women the ability to order their preconception testing on our website, go to a local Quest lab same day, and you usually get your results within 24 to 48 hours. So it's very quick. There's no waiting around for doctor's visits. One thing that I found, and the reason that I started the company, is that the large majority of healthcare providers are actually not educated in preconception care. And so the commonality that you hear amongst women who know to ask for this kind of information and testing is that they'll go to their healthcare provider. Their healthcare provider will say, you don't need anything, just take a prenatal vitamin and come back if you're not pregnant in a year. And that's all they ever get. There's so much literature and guidelines from organizations like the Centers for Disease Control and whatnot that actually talk about the steps that you should take, but it's just not well known. And so our company was really looking to close that gap. Now, in full disclosure, we actually were just acquired by another company. So Preconception is in its transition period right now. We were acquired by a company called Zendara. Just last week it went through. Thank you. Yeah. And so I'm really excited. They have fundraised and have more resources than we did. And so we're really excited to see how they can kind of grow the testing platform and also just the care that you can get. So, there's a lot of components of preconception care. Testing is just one of them. And so we're really looking forward to kind of growing with them and seeing what else we can offer to women.
That's super exciting. I sort of have a selfish question that's coming up based on this, but because I feel like this topic in general is just not talked about that much. I'm in my late 20s. I'm finding so much about like women's health, my health in general, how to take better care of yourself. Like, what are some general like tips or tricks? Like, how can we take better care of ourselves, especially during this pandemic, being locked in at home? Like, do you have any general tips on just like, and it doesn't just need to be for women, but like health in general, any tips, tricks, maybe, things that have helped you as a founder to just stay sane throughout this time?
Yeah, so that's a very loaded question because there's so many things that you can do. As it relates specifically to women who want to become pregnant in the next couple of years, it doesn't even necessarily have to be in that 12-month period. That's like historically what's considered the preconception period. But really the way that medicine is moving is that we're looking at a woman's early reproductive life as the preconception period, right? And that doesn't mean that every woman will decide to have children, but you should still kind of live your life under that preconception window. And that's because anything that you do to help plan for a future pregnancy also helps your health in general, right? So we're talking about things like maintaining a healthy weight, regular exercise, having a nutritious diet. These are all things that have, been shown in studies to improve pregnancy outcomes, but also improve other things like, cardiac disease and decrease risk of cancer and things like that. When we're talking specifically about the preconception period, there's a few things that we always recommend to everyone. Everyone should have some laboratory testing done. The majority of women who are in their reproductive years are asymptomatic in the things that come up on tests, right? So oftentimes doctors will say, or healthcare providers will say, you're healthy, you don't need any testing done. And that's like an oxymoron. You can't tell someone that they're healthy if you haven't done the tests that are recommended, right? And so what we often find is that women will come in thinking they're super healthy. We'll run the recommended lab test. And then, as an example, we'll find like a significant anemia or something that was completely asymptomatic. No one had the idea that they had it. And had they gotten pregnant with that, it could have resulted in a higher rate of preterm labor. It's been associated with things like ADHD and autism and just lots of different things that are super preventable. Like that's what I always tell people is, when you're in your early reproductive years, you have the ability to prevent so much, both from a future pregnancy perspective and just, again, like these chronic diseases that we see a lot of women having more often. And so at minimum, I say have a preconception visit with your healthcare provider. You might strike out, find another one, and maybe one day we'll be able to offer that through telemedicine. That's really our goal. Get testing done, and then do those lifestyle things like start taking a prenatal vitamin, exercise, healthy diet, all those things that you would want to kind of do anyways. Use that like pregnancy, that future pregnancy as your motivator.
That is super helpful. And I actually didn't know that most of the cases are asymptomatic, which is both scary but helpful. I am gonna try to do less of the late night Taco Bell runs moving forward. But okay, so that's a good place to start. You mentioned something else, and this can be a question for everyone, but sort of like the future of women's health, like where this is going. Have any of you noticed any trends or opportunities more recently of like, where is the future of women's health?
I can jump in. I mean, femtech is hot right now. Roe, which is the Roman and Rory, they just bought Modern Fertility, right? And it's insane because, they're so bullish on femtech, all of us, there's just a lot of money out there and everyone's all of a sudden very interested because finally 50.8% of the population is getting the attention it deserves. The government pays for Viagra. The government, we get one OBGYN visit a year, right? That's what's wrong with this picture. We have to buy tampons with, there's all these things that are not provided to us. The government doesn't provide us with tampons. We are neglected. And we are also the ones that make most of the healthcare decisions in the household. So I think that there's finally a wake up call and there's amazing founders like my other panelists here where we're just this isn't right. This is not right. And a lot of it's based on our own experiences. Like Crystal, I had a terrible experience in college, so bad that I didn't go back to the OBGYN for 4 years. Okay. And that should not have happened because a lot of bad things could have happened to me during that period, but it was so bad and nobody explained anything to me. And I ran out of there crying. So I think it started as women, we're just enough. This is enough. We have been through this personally, as women, we know that this is an issue and we're there to start fighting this battle to say, nope, you got to pay attention to us because, dick pills just get funded, hair loss things, anything like that gets funded right away. Right. But you talk about vaginas and stuff and all of a sudden everyone's yeah, let me ask my wife, what? So that's just my 2 cents. I'm very passionate about this, obviously.
I think that we're seeing slowly, I think it's still a really slow progression, but I think that we're slowly seeing women's health, the importance of women's health recognized as it relates to, as Audrey said, family health. Women's health is family health, not just from a pregnancy perspective, but because women tend to make the healthcare decisions for their family. And so if women are not taking care of themselves, they're not able to take care of their children, they're not able to be employed and things like that. And so Along with that, we're seeing a lot of research coming up about things like epigenetics, where, you know, what you do before and when you're pregnant not only affects the future of your child, but it might even affect generations after that. And so we're seeing where we're actually having a recognition of the importance of women's health in the reproductive years. And again, not everyone has children, but the large majority of women still today do have children at some point in their lives. And so focusing on women's health, I think, pays dividends, like probably more than anything else. You know, I can't give data for everything, but for preconception care, there's been studies that have shown that for every $1, sorry, it's like a really loud plane. For every $1 invested in preconception health, you save $5 on the back end from, you know, decreased NICU stays, decreased pregnancy complications. And then that often doesn't even look at the lifetime cost of the child as a child and an adult, right? So people who are premature tend to have a higher risk of health problems throughout their entire life. And so then you're talking about that, you know, potential baby becoming a adolescent and a woman and needing these services, you know. And so I think that very slowly we're finding that the importance of women's health, and people are recognizing it. I do not think it's recognized at the level that it should be in 2021, especially given how much data is out there. These are no longer theories. Like, there is hard research to back up everything that every single one of us are doing. And it's just, again, the money is still not where, it's just still not there. We're seeing, I think, definitely a bigger investment, but not at the level that we should be. So I'm hopeful for the future of femtech. I think it's going to be slower than any of us want it to be, but I think it is coming.
We had one question that was pre-submitted that said, for founders that, or for any of the panelists who don't have a background in healthcare or don't have a medical background, what have been your biggest challenges and how have you overcome them?
I can answer that one. I don't have a background in healthcare. I am an entrepreneur, true and true. And, you know, my whole goal has been to, you know, solve big problems, right? And get the right teams to help me accomplish those things. So I think one of the barriers to entering this space initially was the lack of knowledge and lack of the like MD by your name, or like not really like working like as even like an MPH, for example, like not having that background. But I think it also came with its own positives. And the reason I say this is, you know, I came from a different lens. I came from a user lens. I came from a person who experienced something like this lens, right? Versus what you're taught like in medical school or as a physician. You know, a lot of times it's around like taking care of the person, and healthcare in the US tends to be very reactive versus proactive. And that, you know, kind of goes towards everything that Kristy said. And that's why I'm just nodding and chiming, because, you know, I'm not, you know, I don't need to add to things that she's clearly stating are facts, because, you know, a lot of times, you know, what we see is, you know, not bringing people who are going through day-to-day lives and experiencing this into the conversation is a problem. So when I came into this, you know, with my background in business, you know, I started to do a lot of, you know, customer discovery, but I spent a lot of time talking to physicians as well. So, you know, you can't really go into the business not knowing critical aspects of it. So a lot of like phone calls with doctors, a lot of like, you know, I do a lot of coffee with so many physicians, just trying to understand, you know, how's the space, how do we understand it better, and how can we make it better, right? From the lens of how's your day-to-day life? Like, what are you experiencing as a doctor? What do you think, you know, patients want, and how do you want to affect that? So coming from that angle was really helpful. But in the beginning, it's kind of like, you don't have a track record in healthcare. So the question is like, how do you know how to serve healthcare? But I'm like, I'm a woman first. There's lots of men that are building things and don't have a background in healthcare. They're building products for us. And you look at them and they're like the bigger companies out there. So I already had the credentials as being a woman, right? First, and, you know, being a really good business person as well. So those were some of the things that helped, but I would say it was challenging in the beginning getting there, right? And I think the path to there was getting the support I needed, getting a co-founder who was a physician eventually was very helpful in the process, because her perspective is also very valuable always, right? So sometimes she hears things when I get a question, and I respond with my business mind and she responds with her physician mind, and then we're just like, okay, tag team, and we high five each other, and we know like we're following each other, on an aligned vision at the end of the day. But in the beginning, it's very important to get a team, and that's I think that's the bigger answer here: getting a team around you to be able to fill the gaps where you don't have them, because you don't know everything, entering a space like this that you don't have the most expertise in. So getting a good foundation and a great team is always very helpful.
So I'll jump in. I don't have a background in healthcare either. And I actually, I came from the world of conversational AI. So for me, I see a lot of data points that can be collected within this industry, but I'm very fortunate that my co-founder, Allison's mother, is an OBGYN, right? So Allison grew up talking about vaginas at the table. So she's much more knowledgeable than I am. But Crystal, after we talked to you, you're like, wait, you're chief medical officer. Why? Just ask your mom. And we're like, oh my God, why do we even think about that? And so now Allison's mom, Dr. Vivian Greenberg, is our chief medical officer. And she's been at OBGYN for over 40 years. Her practice has delivered 30,000 babies. So the question of us not having a medical background is no longer even on the table. And again, Grid 110 love, right? Crystal, you just pointed the obvious out, and we're like, oh, and you're laughing, but it was a great moment. So that's kind of how we kind of overcome it. I mean, I do come from a family. My mother's an MPH. My mother-in-law has a PhD in nursing. So I do come from a family background of healthcare. But, personally, I come from it with a different lens, just like Crystal does, right? I am a patient. I see things that happen. I've been through really bad experiences, and it's just different when you're a provider versus a patient. Providers sometimes are just very rushed to get you in and out, and they don't really care because they're pressured to see a lot of patients. As a patient, you want more time. You don't want to just be like poked and prodded and then pushed out, right? There's a lot of questions, and that's why, our platforms exist.
Thank you for that. I love the little grid moments. I love it. That makes me so happy. That like you're not alone in this journey. Like whatever industry you're in, you find your community, you find fellow founders who are in the same space and who can give you advice and who can point things out that you are sometimes not seeing. So makes me super happy. If in case we have any like early stage founders in the audience, or anyone who's going to rewatch this, who's just like starting out, or who wants to start like a femtech startup or a company centered around supporting women's health, like are there any things that you wish you would have done differently, or things that you learned in hindsight, like advice that you could give to any other founder?
I can jump in. This is like, my second startup. So have a North Star. It's hard. It is hard. I mean, there's a glamorous aspect of it that people sometimes think, right? Oh, it's like Silicon Valley, the show. It's not. It is a lot of hard work. And as a female founder, it's even harder, but don't give up. Don't give up. Like I sold my last company. Kristy just sold her company. The stuff is possible. It's hard work though. And always reach out. Like Grid 110 is a great community. Like I got connected to these wonderful women. Kristy was in my class, Crystal was in a class before me, but the community is really important because you can learn from each other and support each other. And so as a founder, you're, typically in a very strange headspace from most normal people. So you have to find people that kind of think divergently as you do. And that community is just more, Grid 110 has just been amazing for us for growth.
Yeah, I think my main advice, and this is just all the learnings with the sleepless nights and all the hard work in this business, is just, remembering and realizing that you're enough. I think that's very, very important, because, we have like imposter syndrome, and sometimes like you're super stressed out and you don't have like, you don't feel like you're doing enough, and you don't feel like people are going to take you seriously. And that really stops a lot of people from going from point A to point B. I remember in my early, periods of my very first fundraising round, I was just like so terrified because I was like, these investors will never take me seriously. Like, I don't know this, I don't know that. But like when I realized that I was enough and what I was doing mattered, and I was the best person to do it, then, my mindset really changed, and it showed. It showed in the way I communicated my expectations to like my potential investors. It showed in the way like I thought about building the business, because I was just like, I'm the best person to do this. And realizing that is very important. And it takes a lot to get there. I do recognize this because I struggled in the beginning. But that's the only way to go from, this is an idea to this is $1 billion business, because you're the only one who's going to build it. And knowing that even allows you to know like who to bring on along the journey, right? So I'm enough, one, but here are all these people who can complement what I'm doing and make me even better at where I'm at. So that's my thought.
Kristy, anything you wish you would have known when you started?
There's a lot of things that I wish I would have known. I was a first-time founder, and I can actually really understand why investors like to see people who have had companies before, because you learn so much going through it. For me, I actually wish that I would have started fundraising earlier. One thing that I found in my experience was that it seems a little bit easier in a lot of cases, at least with femtech, to raise money on an idea than once you start. So like in our case, I felt like the expectation for traction was a lot higher once we had already launched. And in my mind, as someone who was not an entrepreneur and did not have a business background, I was thinking, it's going to look so great that we bootstrapped and launched a national company. Like, that should be really impressive. But what I didn't realize is that we were at a disadvantage because we were bootstrapping still. And so you don't have that fast growth that they like to see once you're launched. Whereas if you launch on an idea and you get people bought into the idea, in hindsight, I think it would have been easier, because then we could have launched with funding and had the resources to invest in that like faster growth.
Those are
I
all
feel like
really
I
tips.
resonate with that very much, Kristy. I feel like it's that I love that you said that. I just wanted to chime in there because I feel like, at the end of the day, like traction always needs more traction, right?
Yeah.
And that's one thing that I've learned, like going from pre-seed and everything was, oh my God, like we can do this. This is a great idea, to your seed where you're just like, what have you done? And we're like, we've done all these many things. And they're like, what else have you done on top of that? Right. And we find a lot of our male counterparts who really start fundraising on an idea and do it very well. I have a friend who didn't have a product, who had an idea, who raised $10 million within, I would say, a couple of weeks of launching his idea. And, he was coming to me for advice, and I'm just like, we're not on the same level here. I might have done this for way longer than you, but, I wish I knew what you just said, which is more like jump into it, show the world that, hey, like I can do this now, and get the funding that you need early. Because what you don't want is to be in a rotten place where, you're not moving quickly, you're snailing, and it feels like you're not doing your job, but you really are. You just don't have the financial backing to scale. So that's a great point, Kristy.
Yeah, I'm glad to hear that I'm not the only one.
Listen, we get 2.2% of funding, all VC funding. So one of the advice that we got was like, raise less more, get going, and raise a bigger round afterwards, because, we raised on an idea, right? So it was not easy, but then when everything fell into place, it happened very, very quickly. And all of a sudden I was like, this must be how a tech bro feels. People throwing money at you. What? Like, this doesn't make any sense, right? I mean, we were stuck. We have this money wall where we like put how much money we have, and we were just stuck for a long time. And a lot of it was just coming up with different ways of presenting the idea. And it's a lot of that storytelling. And then it's just not, we don't have the same piece of the pie. But that being said, there are a lot of funds now that have dedicated to investing in women with specific funds. They call them female founder funds. And so it's getting a little better, but honestly, like VC funding for women last year actually went down from the year before. So that's just the reality we live in. And meanwhile, as Crystal says, a guy can go and have some crazy wonky idea. Like, let's talk about Clubhouse, okay? How did they get so much money? Like, it's a 1-900 party line. So, if you just want to delineate really what it is. So, that's kind of just what you're looking at. And you just have to, it's just the way the world is, right? You can get mad about it, but it is the way it is. And you just got to do you.
I had $1 for every time I said, how did they get so much money?
Because they were ex-Google, Facebook guys that went to Stanford.
Yeah.
So to summarize, you got to move fast. You got to have a community around you. And you got to have confidence in what you're doing, confidence that you're the right person, that you have what it takes, that your idea or your product is worth it. So I feel like that's a good formula for success. We had another good question pre-submitted. If this applies to you for your company, but in what ways do you specifically support women of color through your work, if you do?
So I can go. So our company is dedicated to increasing access to health resources for young women, but specifically women of color. And the whole reason is, beyond like just seeing someone who, has the same skin tone as you or, anything like that. It's about connecting folks to providers who understand, these, like I said before, like the racial and social nuances of healthcare, and also creating a safe space for them to seek this type of care. A lot of what, we do, when we work with colleges, specifically like community colleges or smaller schools who have a high demographic of this population, is to make sure we're providing access in a way that they wouldn't have access to, right? Their colleagues in other schools, like the larger schools, might have like providers and all of this stuff. But when you go to a small school that is like in the boonies somewhere, like you might not have a provider like this. So, being able to provide that care and also resources is a big full face, or not just physical or mental. Sometimes, there are students who we're working with who are food insecure and housing insecure and really don't have access to things that would even prompt them to seek healthcare. Like you can imagine, like it's a luxury to pick up your phone and see a doctor. That's because you have a phone to see a doctor and you have the time to do so, right? There's so many people who, even with these things, can't. So a lot of the work we're doing is making sure that we're working on populations like that. And as we get grants and resources, like we recently got a grant from Shea Moisture, and we put it strictly towards, students who don't have access to certain things and making sure, they're thriving, right? It's about thriving and doing well, because at the end of the day, if you're not hungry or not homeless and things like that, then you can be like, okay, well, maybe now I want to see a doctor, right? And now I want to see a doctor who understands me specifically and who's not going to rush me out of the door, right? Going back to what we said about, how doctors have this revolving door of like, people going out and coming in, but building relationships with, our users is very important. And, that's what we try to do. I mean, in my personal work as an individual, I do a lot of work with like women of color and finding ways to plug them into spaces that they do not have access to. Once I step into a room and I have access to something, you bet that someone else is following me behind, because that's something that, folks that don't look like us are doing really well. And we need to adopt that and make sure, that is available, because the more women of color who are involved in these conversations and can build companies like this, the more our healthcare will get better. because, you know, if you're not building, someone else will. And if that person is not representative of you, then your problem does not get solved the way you would like it to. So there's a bigger conversation around that, but like there's more and more women of color who are coming into the healthcare space specifically. I remember, you know, some corporations in the middle of COVID were like, hey, like we're looking for a woman founder to incubate our women's health, you know, a Black woman founder to incubate our store. And I was like, no, like there's so many women of color that are building these things. Look for them and give them money and invest in their efforts, right? So those are important things, you know. So what, like I said, what I try to do is make sure our platform is doing that, but also, you know, outside of this work, making sure other women of color are coming into this space, because I think it's really important. So, and getting funded while they're at it, right? So, yeah.
I can answer this in terms of Ruth Health. So we actually accept diverse payment methods. So that's everywhere from insurance, FSA, HSA, cash, and also Medicaid. And that's where we are going to reach a larger population. We are not a 1% company. There's a lot of femtech companies out there. Will not name them, but they require, you know, a membership fee, right? And their clinics are all in like really like wealthy areas, and that is not accessible for everyone. We have to democratize this care, and our providers, we are going to provide providers who live within the communities they serve, so that there's a comfort level, right? There's a relationship. We believe in continuity of care. We believe in a relationship you're building with your patient. So when our our providers go into someone's home, they know the name of your kid, they know the name of your dog, right? This is becoming someone you trust. They're part of your community. And, you know, we're providing, you know, evidence-based care. So, you know, really just trying to reach a lot of demographics that a lot of companies in our space just are not looking at, and that's just not right.
Thank you for sharing that. Those things really put everything into perspective. I mean, the fact that we have cell phones where we can look up things, or we can call up a provider, make appointments, have things like health insurance, makes me very grateful. For the last couple of minutes, let's open it up for Q&A. So for anyone who is joining us today, if you have any specific questions for any of our panelists or all of them, please put them in the chat, and then we can go through those. And yeah, so if you have any questions, put them in the chat. You can also unmute yourself and just ask the question yourself. If you want to introduce yourself and share a little bit about your company, either way is totally fine. Allison, you can ask your question.
Okay, I'm hanging out outside Audrey's house, so I felt like this was a little preferential, but hi everyone. This was such a great panel. You all did really well, and it's just so nice to hear fellow founders and folks in femtech talk about what they're doing and women's health. I'm Allison Greenberg. I'm CEO and co-founder of Ruth Health, along with Audrey Wu. Thank you, Kristy. My lipstick is made by FemPower Beauty. It is a queer woman-owned business in New York City, where I live. And if you haven't figured it out, we love the entire ecosystem of women founders and women supporting women. I've never seen any organization walk the walk and talk the talk the way that Grid 110 does. So that's just a gigantic shout out to Mickey, to Elizabeth, to Carolyn, to all the women who power this community. I have a question. The question is that, you know, Grid 110, in our humble perspective at Ruth Health, Grid 110 does what a great matriarchy does. It nurtures and it builds. It's gentle but firm. It supports community, and it isn't just here for the power. So my question is, who are the other great matriarchs and builders who are women who are not here, and how can we elevate them? just other cool female founders? Anyone? Who does anyone recommend checking out?
Oh, female founders. Okay. I thought you meant like accelerator programs. I don't know any of those.
I'm calling you a matriarch, Crystal.
I was just like, really awesome. That's cool. So there's so many that I know. There's, a lot of them are, people of color. So there's, a company called Earth. And there's another company called Health in Her Hue, which I don't know if you know this, Audrey. They're also on the HIT lab thing. They're Health in Her Hue. There's, of course, I've met a lot of great founders from the accelerator program I just got out of, called 500 Startups, which was really, really great with like plugging us into the ecosystem. I have a list. I can't remember everyone off the top of my head. Those are the first two that always come to mind because I work really closely with them and we're all aligned on this mission to make women's health better, specifically for women of color. So.
Yeah, I want to give a shout out to, Kimberly Seals-Aller, who is the CEO of Earth, which is just an amazing platform. It's birth without the B because there's no bias. And what it is like a Yelp platform for women of color to be able to rate their OBGYNs. And she's amazing. We've talked to her. She's doing some really, really, really cool things. And there's also, Maven Clinic, which I think is doing some amazing things. Kate Ryder's really, she's really changed a lot of things for us. And she's someone that's interesting to follow. But out of, the woman I admire, there's a lot of them already here. And I'm just so excited that we're all peers. But I would look into, some of the more successful companies that have raised a lot and just to see their path, because there's lots of pivots along the way. It is not a straight path. And, we pivoted. So, things like Tia, right, which is another women's health clinic, started off as just a basic chatbot. The founders are great. They're great, but they pivoted into like a brick and mortar, trying to rebuild the whole system. So I think that's very interesting. Carolyn Witt and Felicity Yost are the founders of that, but there's just a lot of money pouring in, but it's also very interesting to see their journeys. How do they get there, right? How did Tia become the only female-led company that raised $24 million last year, right? She probably was like 1% of the 2.2 that we got, right? So kind of like learning from how they did it and looking at their founder stories and just seeing like the changes and pivots they had to make to get to where they are.
One person that I would shout out is Allie from Robin. She was willing to speak with me before we exited Preconception, and she was just incredibly transparent. Like, I find that it's so valuable as a first-time founder and as an early stage founder to have people who are transparent and be like, listen, this did not work for us. We lost a bunch of money on it. Like, instead of people always making things look so rosy, like whenever I looked at LinkedIn, it's like all of the wins, which is of course awesome, but it can make you feel like you're the only person not winning. And you don't, if you don't have some like newsworthy thing to share. And so she was really helpful for me. And then also there's something called the Women's Health Innovation Coalition, which is an organization that actually works on, they have several things they do, but one of the things they do is they work on the advocacy arm. So they essentially have members, like femtech company members and other health tech company members, but they have a femtech arm. And they actually work with policy, which I think is really undervalued. Like, if you cannot get Medicaid to cover certain, like the government and Medicaid to cover certain things, a lot of times private insurers will not cover them. So Medicaid is what pushes private insurers a lot of time to cover things and recognize when something's important. And so the advocacy piece is so huge. As like Crystal and Audrey mentioned, like a lot of times these femtech companies target middle upper class women, right? Like, because you have to make money in your company and you have to show growth, and it's hard to do that with low income populations. But most of the time, the low income populations are the ones who need these services more than anyone, because they don't have the tools to advocate for themselves. They're not able to go to their doctor and then recognize that they didn't get the care they need and then find another doctor, right? They're just stuck with the provider that they're assigned to. Even if they recognize that it's bad care, at least they have care is kind of the thought. And this carries through to every area of health, but specifically again in femtech. So I really appreciate what the Women's Health Innovation Coalition is doing when it relates to the actual policy components.
Did we have any other questions?
I have one, or more of because I just launched my business in March, but it's been going very, very slowly, and I don't really have any financial means or a lot of financial backing. Just kind of, I feel kind of stuck basically, and so I don't really know where to go from here. And I'm doing everything on my own. And I mean, I didn't even know about this community until a couple of days ago. And I feel like I've been looking for something like this, more of like just a space to kind of talk to people who have, experience, and just to get motivated and inspired again, because I've kind of lost it a little bit. So like any advice or any, I don't know. It's kind of my question / cry for help. I'm kidding.
Yeah, I think my advice here would be to find a grid 110 in your life or something similar.
Yeah.
I think it's the first step, like being a part of like an incubator or accelerator program in the beginning stages is very important, because you build that community that you're talking about. You build the resources, you learn a lot about, how to speak about yourself and how to speak about your company, you build some confidence, you iterate and you make changes, right? Clearly Audrey was saying, like pivoting from like doing one thing to another thing, you kind of find out like what works and what doesn't earlier rather than later, which is really great. And in part of the process, I would say, like on the financial side, I'm a big fan of going out there and, just taking the bag, meaning doing a lot of like speaking. And when I say speaking, it's more like competitions are great. I had a streak where I was doing a bunch of those. I no longer have the capacity to do as many, but it was nice in the beginning, like being able to like win a lot of money. That's usually free money that you can use to like build right in the beginning stages. And if you're not doing those, that's fine. You can also look for like grant opportunities and things like that. And that's where like an ecosystem is important, because, sharing ideas and things like that. If I run into something, I can share it. If someone else in here runs into something, I know Elizabeth and team are, usually pretty good at like sharing opportunities that are available. So sometimes you just don't know where to start. So finding someone, I would highly suggest, following up with Elizabeth or Mickey after this, and kind of seeing.
Already, yeah.
That's my suggestion.
For sure. Thank you.
I'm going to say the same thing as Crystal. Just go do pitch competitions, sign up, start practicing, right? And that's when you're going to meet really cool people and, mentors. That's a really big part of the pitch competition. Sometimes they assign you a mentor. And that's how you're going to start building your network. Like one of our mentors at one of the first pitch competitions we did is chief of staff at Roe. Like amazing, right? Like it was just such a perfect match for us. And so yes, absolutely. I think, get yourself out there, and places like Women's Health Coalition are also very helpful, like Kristy mentioned. These are all free resources. They don't take equity, and you don't have to pay for it.
That's awesome. Yeah, great. Thank you.
Yeah, definitely join Grid 110. And I'm so happy your friend told us.
Yeah, me too.
Share that with you, because it really is an amazing community. Especially if you are a solo founder or a first-time founder. I just want to validate, like, whatever you're feeling is very real, but you're definitely not alone. Like, it's very common to feel that way, especially if you're in the early stages of building. But that's what we're here for. We're here to support and help you along the way.